So we're now looking at Pennsylvania's statutory physician-patient privilege. And so we've talked around privileges. We've talked about, how they exist, who holds them. At the end of the day, what a privilege means is that if you have a confidential communication between two people, then there are limits on when, through a subpoena, through compelling a person to come and testify either at a deposition or at a trial, there are limits to when that person can be required to testify if the conversation you're being asked them to speak about is one that is subject to a privilege. If you bring one party on the stand and say, what did your wife tell you about the bank he was going to rob, then that may well be a question that she either is forbidden to answer or that she can refuse to answer on the grounds of a privilege. This is a question about who holds the privilege. If you hold the privilege, then you can refuse to answer the question. If another person holds the privilege, that person can prevent you from answering the question. So when would another person hold the privilege over you? Well, that's answered in today's statute with the physician-patient. So let's say that someone was accused of recklessly endangering the lives of other folks, or actually attempted murder, as was claimed in a couple of cases where AIDS patients went out and knowingly had sex with other people. The question was, were they trying to kill other people, or were they recklessly endangering other people by having sex with them knowing they had this disease? So could that AIDS patient's doctor testify that this person was HIV positive? The answer is no, not under this statute, because the patient is the holder of the privilege. If you look at the statute, it says no physician shall be allowed in any civil, of course, it's a civil case. Say it were a civil wrongful death or civil assault case. No physician shall be allowed in any civil matter to disclose any information which he required while attending to the patient, that would tend to blacken the character of the patient without that patient's consent. So the physician-patient privilege is one which the patient holds. Your physician could want to talk all day long about this disease that you had. Imagine in COVID, make it less sensational and make it more timely. Let's say someone has COVID, and they go out, they go on a bus, and don't wear a mask, but they knew they had COVID. Could your doctor testify in a civil wrongful death claim that someone else brought that you actually had COVID, that you tested positive for COVID? No, not in the civil case. You can prevent your doctor from speaking, even if your doctor wants to testify. The patient is the holder of the privilege. Any information the doctor learned in the context of the doctor-patient confidentiality relationship or confidential relationship is something the doctor cannot, even under subpoena, come to court and say. The patient can preclude that testimony. The patient is the holder of the privilege, and it's far more common that it would be the case that the privilege would be used to prevent another person's testimony, rather than the privilege being used to the person who's being called saying, I prefer not to testify. But that's what we'll get to with Trammell and the spousal privilege.